We hope you all had a great break, sponsored by Ledient Biosciences, and were able to get in some quality networking time. Thank you for joining us today at Track 2, Building and Activating Your Community. For the last track breakout session for this day, I am Leah Trotter, and I will be your host for today's session on developing partnerships among rare communities and individuals. As a reminder, this track is being live streamed, and I would like to welcome our remote attendees and remind everyone to download our mobile app and use the live Q&A feature. We should never underestimate the power of partnerships. Developing partnerships with communities and individuals can be beneficial to the success and advantages in collective initiatives. Today, we will hear from a panel of advocates who are experts in partnerships. Kari Rosbeck, President and CEO of Tuberous Sclerosis Alliance, Julia Jenkins, Executive Director of the Every Life Foundation for Rare Diseases, Angela Ramirez-Holmes, Founder and President of CalRare, and Tania Simoncelli, Director of Science Policy at Chan Zuckerberg Initiative. Moderated by Maureen MacArthur Hart, PhD, Strategic Advisor at Global Genes.
All right, everybody, thank you so much for joining us. And I think some of our panelists had a few words that they wanted to open up with regarding some of the partnerships and collaborations that they've developed and what they've learned from those opportunities.
Hello?
Oh,
Sorry.
hello.
All right. First of all, I just want to tell you a little bit about the Tuberous Sclerosis Alliance. We're actually 45 years old this year, so we've been around for quite a while. We are focused on finding a cure for tuberous sclerosis complex while improving the lives of those affected. We do that by developing programs, support services, resource information, like many of you, by stimulating and sponsoring research, and by creating public and professional awareness of tuberous sclerosis complex. So you might be saying, what is tuberous sclerosis complex? So briefly, it is a rare genetic disorder that causes tumors to grow throughout the body, is the leading genetic cause of epilepsy and autism. It affects about 1 in 6,000 live births, 50,000 Americans, approximately 1 million people worldwide. And neurological manifestations are often the most devastating in tuberous sclerosis complex. So I put a couple of our wonderful partnerships on this slide just to highlight the different ways that we work with different organizations. And there's two that didn't make it on there that I want to talk about too, and that's Haystack, who we work with on public policy, and the Rare and Catastrophic Seizure Consortium, which is a group of rare epilepsies that work together on many, many, many different fronts, including research, support services, transition issues, everything in between. So I just wanted to highlight a couple of the partnerships on here. We have many, and just because I highlight a few doesn't mean that any are less important, because they are all important. Collaboration is part of our core values and also part of our strategic plan and how we deliver support services and research. So first I want to talk about the Infantile Spasms Action Network. This is a collaboration of 30 different organizations. It includes patient advocacy groups like the TS Alliance and Seizure Tracker and LGS Foundation. It includes professional associations like the American Epilepsy Society. And it also includes industry. It is convened by the Child Neurology Foundation, and since 2015, this collaborative has grown and really been focused on raising awareness of infantile spasms, really highlighting and accelerating the time to diagnosis and appropriate treatment. And as a result, working all together last year on Infantile Spasms Awareness Week, which is always the first week in December, there were 194 million media impressions because of all of these amazing groups working together. And so really amplifying awareness of infantile spasms, which is a very catastrophic type of seizures that happen in infancy. The other partnership that I'd really like to talk about is with the LAM Foundation. And LAM, lymphangioliomyomatosis, and TSC share a genetic mutation. We are two separate organizations, but we work collaboratively very, very, very often. So we've held regional conferences across the country together, offering our patients the opportunity to learn about resources, about research that benefit both of our communities. We've actually held a joint international research conference, and the researchers absolutely loved learning from each other, and there were lots of collaboratives in research that were formed out of that. And we worked together to march on Capitol Hill and really to inform federal funding that goes into our diseases. And that means the world. And in terms of individual, and I'll just stop here, our individual partnerships, we have 37 volunteer branches, not state incorporated, but volunteer branches of our organization across the United States. Those are run by individuals impacted by tuberous sclerosis complex. They might be an adult living with the disease. It may be a parent of a child, an aunt or a grandparent. And across the country, we have 2,900 volunteers that work with us. There's no way that we would be able to deliver a really meaningful support programs or to catalyze our community for clinical trials without these amazing volunteers. And so those are some of the ways that we partner.
I think I'm mic'd.
Yeah, you don't need
You
the
want me
mic.
to go next?
Yeah. Keep the mic, Kari.
Oh, keep the mic.
Hello, can you hear me? Hi, I'm Tania Simoncelli, and I'm the Director for Science Policy at I don't have any slides, so. At the Chan Zuckerberg Initiative. I want to tell you a little bit about what CZI is about. We are, I think I'm the only philanthropic organization represented here on the panel. So we're not a rare disease group. We are a philanthropic organization that was founded by Mark Zuckerberg and Priscilla Chan following the birth of their first daughter about 3.5 years ago. CZI works on a broad array of really big, thorny issues and challenges facing society. So we have a pillar that's focused on education with an emphasis on whole child learning. Another that's focused on different issues around justice and opportunity with an emphasis right now on criminal justice reform and immigration and affordable housing. And the third, which is most relevant to our conversation here, is focused on accelerating the science and technology we need to make it possible to cure, manage, or prevent all disease by the end of the century. So what's common across that really broad range of issues that we work on is actually that we believe that collaboration is the key to actually making progress with these really, really challenging problems. And basically, we believe that these issues that are so challenging that in our society are so significant that we can't possibly think about it like one person or one organization or one group of stakeholders or one community addressing them alone. That the way that we make progress is by working together, both within and across fields, within and across different stakeholders. And so everything that we do at CZI, we look, everything that we fund, everything that we think about, we actually put collaboration front and center at every strategy. So a couple of ways that we do that. One, as a philanthropic organization, as an organization that funds efforts, we look to incentivize and promote collaboration through our funding programs. And another way that we do this is a little bit, or is my mic still on? Yeah, okay. And then the second way is that in addition to funding, we're a little bit different from a traditional philanthropic organization. We actually look to integrate not just funding, but also technology and policy and advocacy as we look for designing solutions. So, and we believe that the answers and the solutions to these problems lie in the communities that we're aiming to serve. So the people who are closest to the problems, they're the ones with the solutions. And so we look for solutions in these communities, and then we look for ways that we can partner directly with those communities to leverage and scale those solutions and make them more broadly available. For example, through technology and developing open source tools and those sorts of strategies. So in June, we launched the Ramirez-Holmes program, which is the program that I lead out of the Science Policy Program. The goal is to support patient communities in their efforts to accelerate research in their disease area. We know that more and more patient advocacy groups are taking on more and more responsibilities, really, really huge challenges in not just partnering with researchers, but actually driving research forward. Building the communities, like reaching out to researchers, fundraising for research, really helping to direct and shape research strategies. This is enormously, creating registries, patient-led registries and biobanks so that the resources, these critical resources for these rare diseases rest with the communities and aren't sort of sitting siloed off in some particular like individual research lab and that may face challenges of sharing those things in those sorts of situations. So we know that this is happening and we really want to support this patient-led research approach. And so we're looking at ways that, again, we can sort of integrate our capacities of grant-making, technology, and policy and advocacy to support rare disease communities in these efforts. So we launched the program in June, and I'll talk a little bit about how we grounded this in collaborations. It's obviously a brand new program, so we don't have nearly as many partnerships as you guys have created. But so one of the very first grants that we gave and partnerships that we created was actually with Global Genes. We are supporting the Data DIY series that some of you may already know about. This is a series of workbooks, interactive workbooks that Global Genes is creating to help patient groups when they're thinking about how to go out and build a registry. So what do you need to know? What responsibilities are you taking on as to be a responsible steward of the data for your community? How do you think about that? What are the things that you need to know? The legal challenges, the ethical issues that you need to be thinking about, for example. How do you think about what data you should be collecting? So Global Genes does an incredible job with these sorts of workbooks and resources for the community, and we recognize Global Genes as one of the really amazing organizations that is bringing this community together and fostering collaborations. So in an effort to sort of further that, we are partnering with them on that really, really great effort. And we work directly with them. Heidi, who's in the audience, is our patient engagement strategist. She participates in weekly calls with them and really is really on the ground with and learning with Global Genes as we figure out how to provide these resources to the community and develop them. So that's the first one. And then secondly, when we launched our program in June, we announced our very first funding opportunity in this area, which was an opportunity. We invited rare disease communities to apply to join the Ramirez-Holmes network. And we're looking to fund groups to create patient-led collaborative research networks. In other words, to create networks of patients and researchers and clinicians to work together to develop research strategies for your disease area. And this was very much modeled, part of the inspiration for this initial funding program was David Feigenbaum and the Castleman Disease Collaborative Network. David, if you don't know David's story, you should definitely come to his talk tomorrow where he's going to be talking about this, and he just released a book, a memoir about his struggle with Castleman disease. And what was so amazing, I think, about what David did is he recognized that the most important thing he could do is to build a community, that there just wasn't a strategy to address this disease, that there were a bunch of different researchers working on the disease, but they weren't talking to each other. There wasn't really a unified approach. And so he went out to actually build that community, connect the researchers with the patients, with the clinicians, and get them all talking together, crowdsourcing research ideas, figuring out what the research priorities should be. And then he created a foundation that could then raise money, and rather than just putting out an RFP and sort of seeing who applied, he could go out and actually fund research in order of priority. Like, what is the most important thing that we need to do right now at this time to further our understanding of this disease? And wouldn't it be great if every rare disease took that approach? And so part of the idea behind the Ramirez-Holmes network is to create a network of networks to start to fund some groups to see, can we replicate and scale this model? Can we create a group that can both create these collaborative networks, but also collaborate among themselves and learn together as a community to figure out how to do this and how to do it best and how to optimize the model. And in addition to that, we're actually partnering directly with the CDCN. We're, to not just give these groups funding, but we want to also be able to provide them with tools and capacity building and training in order to sort of figure out how do you create a collaborative research network? How do you find the researchers and bring them together and encourage them to work together? And what we're doing with CDCN is CDCN used, David identified a bunch of off-the-shelf tools to use to identify researchers, to bring them together, to crowdsource research ideas. Those tools weren't really designed for rare disease communities. And so we're looking at all the tools out there in the community, partnering with CDCN, looking at what else is out there, looking at a way we can optimize the set of tools that he used for CDCN, and then thinking about how to make those tools available to the broader community. So those are just a couple of things that we're working on. Really great to be here and looking forward to the discussion.
Julia?
All right. Good afternoon. So I'm going to talk today about how collaboration became our model at the foundation. Just a little bit about us, if you don't know. We are a nonprofit, nonpartisan organization dedicated to advancing the development of treatment and diagnostic opportunities for our patients through science-driven public policy. So very specific, narrow focus. One of the things that we very much pride ourselves on is that we do not speak for patients. We provide the training, education, resources, and opportunities for them to be heard. So this was a very early motto that we started at the foundation by our founder, Dr. Emil Kakis, who really was not about promoting the foundation. It was all about what we could accomplish, and we didn't care who gets credit. And that's really what has been a driver of why we are successful in collaborations. So one of our very first needs for collaboration came out of our goal to engage patients at a local and regional level and activate them in state and federal policy. So we launched this very exciting program called Regional Legislative Conference. I know, really exciting. So the outcomes: low attendance, expenses exceeded revenue, no sponsors wanted to support. And then the patient surveys actually reported that they wanted more than just legislation. And we also knew that we were only bringing people in that cared and knew and understand why legislation was important. So there were still untapped people who we wanted to bring in to train. So we had a challenge. How do we meet our goal, but also meet the needs of the community? Because that is most critical in what we do. We don't do capacity building. So who do we want to get into capacity building, or do we want to partner with someone who already does capacity building well? So I reached out to my good friend Nicole Boyce and pitched the idea of doing a joint program. Our teams came together and actually came up with this amazing name, branding, way more fun, Rare Disease Leadership Tour, Rare on the Road. We are very excited about this program. We had 222 advocates attend in 2019. 100% of all of the attendees were recommended to a friend. 71% were satisfied, and 29% were very satisfied. So this was basically our first successful model in collaboration. We raised money through our industry partners. Were very excited about the collaboration. Both our organization and Global Genes, we always say collaborate. It was really important for both of our organizations to create a model of collaboration. So we split the proceeds and the expenses equally. We divide up the work. It's not always easy, but the outcome is really, really fantastic for the community. Another one of the ways that we collaborate is through our Community Congress program. Any of you here who are with a patient organization or industry can join our Community Congress. So when we first started the foundation, there was about 20 companies that were interested in rare disease drug development. And so when they would call and say, how do we partner with you? Just call me, email me. I'm happy to work with each of you. But what's been really exciting over the last 10 years is how much this community has grown. And so in order for us to create a model that allowed us to really engage with all the stakeholders, we created the Community Congress. which is actually quite unique in its form because we give industry partners and patient organizations an equal seat at the table. So each working group is led by both a patient organization chair and an industry chair. We are working in 3 areas of the foundation's focus right now: newborn screening, public policy, and regulatory. And we're very excited we'll be launching an access working group in 2020. Again, 10 years ago, access was not an issue for our community because there was very few treatments. And now this is really something that is emerging as a huge issue. If you are interested in joining Community Congress, we do have a booth in the pavilion. You can stop by and talk to my staff, but we're very excited to have this opportunity. We work on different projects with each working group, and we also use this as our strategic advisory committee. One of the newest partnerships that we have is with the National PKU Alliance. So this was a different issue where a patient organization had an opportunity, they had funding to work to pass the Medical Nutrition Equity Act. So they called us up and they said, how can you help us? We have a little bit of money. We have this bill, it's been pending in Congress for 10 years. Our community is no longer excited about it, but it's critical to help our patient community. So we have a program called Rare Disease Legislative Advocates, which is designed to support the legislation of all rare disease groups. So while the foundation works to drive specific legislation, we also think it's very important that we support all of the community's efforts in legislation, even if it is not around our core policy goals. So through our RDLA program, we established a medical foods policy fellowship in partnership with the National PKU Alliance. We have revitalized the PKU community and taking action on this bill. And our fellow has actually doubled the number of co-sponsors of the bill had at this time last Congress. And they have actually exceeded the total number of co-sponsors that there was for the bill in previous years. So we are very excited about this model, about our ability to help another organization with their legislation. The fellow resides in our Rare Hub in DC and is managed by our RDLA program manager, who has a background in advocacy and policy. So very excited about this brand new program that we've been able to do to support the community. One of our other collaborations that we did, we are very active in newborn screening and advancing policy, but we're still very new to the newborn screening space. We've been in it since 2016. So when we wanted to host a boot camp to help train patients how to get their diseases on the federal recommended screening panel, we looked for a partner that had longstanding expertise in the space and really had some partnerships. We actually were seen as adversaries in the newborn screening space because we wanted to make change. And sometimes when you want to make change, some of the longstanding stakeholders are not too pleased to work with you. So we partnered with Baby's First Test, who also has a booth out in the pavilion, because they had expertise in newborn screening as a public health program. And we were able to have a really, really powerful boot camp this April. I just learned yesterday that one of our attendees, after going to the boot camp in April, has already gotten her assay funded to advance newborn screening for her disease, April to now. So that was really, really exciting to really advance newborn screening in the space, and we would not have been able to do that with our partners at Baby's First Test. And then our final collaboration I'm going to share with you today is our Rare Hub in Washington, D.C. So we were founded in California, and I had been commuting back and forth for 9 years. I do not recommend that. But last year, the foundation decided to move to Washington, D.C. And so when I was negotiating office space, how are we going to pay for office space? How much space do we need? Wow, this is a lot of work to do. I got a phone call from another patient organization that said, hey, do you think you'll have room in your office for us to have a desk? And I got the idea, okay, well, maybe we need to create a shared office space. And so we did. And so last November, we opened the Rare Hub with I think we had 3 partners in the very beginning: PKD Foundation, Parent Project Muscular Dystrophy, and Fragile X Foundation. And since then, we are full. and I'm very excited that we are actually knocking down the wall as of February so that we can expand and take more partners in. One of the great things about this program is that we're able to provide resources to the community. If you have any events in DC and you're paying taxes, state taxes, sales taxes, you don't need to pay those. You can have a membership at the Rare Hub that gives you a DC address so that you no longer have to pay those sales taxes, which is huge savings for groups that have advocacy events in DC. So we're very excited to have this program. It's one of our newest programs and it's growing rapidly. But this was a way for us to really collaborate with the organizations in our office and really support the community. And then I want to leave my presentation with, wow, you're a foundation, you're big, you're established, but this is not something that you all cannot do, right? We created these partnerships because we weren't big, because we didn't have expertise, because we needed partners. And so if you are out there to make a difference, you have the ability to become leaders. And what does that mean? Leadership is not necessarily about being in charge, but taking care of the people who are in your charge. And for us, the people who are in our charge are the rare disease community. And that's really how we run the organization and what we hope to accomplish through our partnerships.
Thank you very much, Julia. Angela?
Thank you. And so that leads perfectly, I think, into my presentation, because 3 years ago I wasn't really thinking anything about doing any of this. So that you can appreciate like how I got here and what we're doing. I'm the founder and president of CalRare, which is a nonprofit statewide organization trying to bring rare disease community together. My entry in the rare disease space, like many of you, was because suddenly my son was diagnosed with a rare brain condition called an AVM, or an arteriovenous malformation. And those 3 letters rocked my world and changed everything for me personally. I had no idea what an AVM was. I didn't even know what a rare disease was. And that was in 2013. So after I sort of settled with this and we got him to be less critical, I pressed the big green button. I might be frozen on my clicker. Okay, thanks. So as many of you, when you first get diagnosis, you're like, why did this happen to us? What is going on? And then the activist in me went, well, what can we do? So we sort of loosely formed a little group, but nothing official, just sort of, okay, we're Team Andrew. My son is a huge baseball fan for the Oakland A's, so hence the Andrew in the little logo. We started walking. We found the Aneurysm and AVM Foundation, which already existed for us. Awesome. And we sought them out, and we said, okay, so we formed teams. We started walking. My son, personally, his experience with Children's Hospital Oakland, he did some toy drives because they brought you a toy every day. And then they had bingo, which was totally fun for him. We were going to be discharged on Thursday, and bingo is Thursday night. And he goes, do we have to go home? Yes. Yes, we do have to go home. So we started doing that. And then I started thinking about California and where we were and said, gosh, now that I know a little more, there are nearly 4 million people in California with a rare disease, half of which are children, including mine. We have a large patient community. There's over 300 organizations in California, more than 2,500 biomedical companies, hundreds that currently work on rare disease, and California leads the world in life sciences research and development. Could there be something we could do more? So we formed CalRare, which is really dedicated to improving the lives of rare disease patients in California, no matter what the disease. And what I found is that, we were raising money for the AVM Foundation, which is great. And me as a volunteer and a walker and a donor, worked really hard to provide the small research grants that the organization provided. But I had a background in policy, and I knew that there was a greater stage if we weren't just talking about brain AVMs, but we were also talking about the things we have in common, the things that all of us experience. And I think from the opening session today, that's what you heard, right? The things that all of us don't have her rare disease, but the things that she experienced regarding misdiagnosis, regarding feeling like they were making it up, people telling her they were making it up, all of those kinds of things, and then life after, right? How do you recover? How do you move on? And I think there are a lot of things like that that are common to all rare diseases. My son was in the CZI Rare as One launch video too. And so we wanted to sort of try to figure out how to partner and bring all of these smaller organizations together and start talking about rare diseases in California as a whole. One of our first projects was the Rare Disease California Caucus. As you know, Every Life has a very successful rare disease congressional caucus, and there was one in Pennsylvania, and all of those reasons I talked about how great California is, we wanted to bring greater recognition. We have amazing things happening in technology, and government is really not that good about innovation. So how do we bring those innovative ideas and start educating the legislature about them so that when it comes time to fund them, they're ready to do so? And that can take a while. So we wanted to bring public and legislative awareness. We wanted to educate legislators and staff. We wanted to ensure patients had a voice. Lots of companies have advocates in Sacramento and through association like CLSA, shout out Manny. But patients really need to be there to tell the stories, because otherwise the stories they're hearing often are the ones following in the news about pharma and other things, and we know that we need all rare disease stakeholders at the table if we're going to get anything significant done. So we are following the mission of changing policy and saving lives. 25% of the state legislature in California is a member of the Rare Disease Caucus. And we have been able to do some things because we are all together. So we are a membership organization. Every Life is a member of CalRare. Global Genes is a member of CalRare. And so because of that, we're able to do things in partnership in Sacramento. In the 2018 California budget, we got $2 million for a whole genome sequencing pilot project. If you were in the genome sequencing, it was Project Baby Bear, that's what they eventually called it, which we have a final report coming out. Being that it's cheaper, we talk about saving lives, and the California state government legislature talk about saving money. So we try to marry those. And we know that this, by getting a diagnosis and then being able to find a treatment, is the way we're going to save lives. And for the California medical system, the healthcare system, it saves money rather than the 5 to 7 year diagnostic odyssey. This year in the state budget, one of our Rare Disease Caucus members got $15 million for the sickle cell disease centers to study sickle cell disease. 7 disease centers in California. Centers for Excellence might be a term you're familiar with, and that is going to be launching, which is huge for the adult, most sickle cell's adults, so it's for adult population. And then California being a newborn screening leader. Every Life has done a great job in newborn screening, and we have the ability to continue to add to what is screened in California, the diseases that are screened. California is now 80 screened, really a leader. I just had a friend who was having a baby in North Carolina, and they screened for 14. So the difference in where you live, as you know, should not matter. We should all have equal access coming in 2020, access to being able to get a diagnosis, being able to get a treatment, being able to get high quality care. And again, this wouldn't be possible if people didn't join CalRare, if we weren't out there getting members. I'm a volunteer. I couldn't possibly do this by myself. We have 3 board members. We have a great support system of other folks who want to help, but there's no way that I could do this by myself. We had to join together and make it a mission to work collaboratively. So here's my plug for CalRare. You can like us on Facebook and follow us on social media, but you can also join us if you'd like to join our efforts in collaboration. I think that the support that we have received from Global Genes and the support we've received from the Every Life Foundation is really what has been able for us to do anything of significance, because the greater organizations then mentor the smaller organizations like us who really have a mission. And we're all working in different areas, and yet it's going to take all of us to really move the needle on rare disease. So we don't do research, but we do lots of collaboration. So I talked about the policy piece because that is the stuff everybody gets excited about. We also do things that are less glamorous, but more personally important to me, rare family meetups and rare support and awareness, and really for the general public. And those are the kind of things where all of those commonalities I talked about rare disease as a caregiver, rare disease as a place that's a little bit lonely. I had friends who didn't hang out with us anymore because I like to say I'm a permanent maybe, because I don't know if I'm ever going to make it. So I don't want to say I'm a flake. I am a permanent maybe. So because my world is unpredictable, and so is yours. And so those are special things, right? So I have to have friends who are going to be okay if I cancel on them at the last minute. And those are the kind of things rare disease families tell us. They need help with navigating school issues. They need help with navigating clinical trials. They're small patient organizations that now, for the first time, really have these opportunities available to them. How do they do that? So people are coming to us looking for things that we can provide to all rare disease communities. So school issues, clinical trials, trying to navigate systems in Medi-Cal, and all of those things, California Children's Services, CCS. So what we're trying to do is provide that way to provide support, no matter what rare disease you are. And that is, I think, really a good thing. And all of us being able to talk and chat, and my son being in a video, us being, them being members of us. I mean, this is how we all work together. And 5 years ago, I would have laughed if you'd have told me I would have been doing this. And so here I am. And so just working hard, and so you can do it too, because you just need to find your people. So join us, or start it in your own state. Find your people, and it's not that I have time. So a favorite quote is, volunteers don't necessarily have the time, but they have the heart. And so you have to prioritize how to make an impact. And if it's not going to help my child, hopefully it's going to help somebody else's. Thank you.
So much for sharing so much of what you've been doing, and the various partnerships and collaborations that you've been working on, and that spans a wide range from support and policy and research. And so I thought we'd take just a few minutes here to have a little bit more of a panel discussion to think through some of these issues that we have in common, that you've found in common across all these different types of partnerships. And so you talked a lot about advantages to collaborations and things like that. And I was wondering, what are you kind of looking for when you're thinking about beginning partnerships? What kind of steps are you thinking about taking to either begin or expand partnerships, looking for more partners, or really trying to think about taking that first step with thinking about a partnership?
So we do it informally. So just before this session started, I'm talking to Ken and Barbie, and they're like, oh, well, we're having this summit at UCLA in November. These notebooks that some of you grabbed, the green ones, these are pretty great. And they said, oh, well, do you think that we could pass them out at our summit in UCLA? And I'm like, super, how many do you need? So it can be informal, just ways to sort of share each other's organizational goals, and they can go to formal, to grants and complicated forms and other things, but they can also be just casual. Somebody said, oh, I would like to provide some services for Spanish-speaking folks in Fresno, and I said, great, how can we partner on that? It's just always being available for whatever opportunity, whether it's 5 minutes before you're about to speak in a session, or whether it's somebody calls you and says, I have this idea, and you go, great, let's work on that together. And so I don't want you to think partnerships have to be super serious. Some of them are, and formal, and some of them can just be ways to bring attention to, help someone else bring attention to their rare disease or their advocacy efforts. So I just want to start by just saying that, like, it can be super casual of a well, how can we do that together? How can we do that better together? And that's really, for me, always what I'm thinking about. So I'm sending notebooks to Arizona.
I think we look for areas where maybe we don't have capacity, or areas where there are challenges where we can work with other groups to really make an impact. So one of the things that comes to mind is, for those that live in the rare epilepsy world, we started thinking about behavioral challenges in TSC, and as we reached out to all of our friends, we all realized that this was something that we shared in common. And with the work of the Child Neurology Foundation, now they've done some surveys in parent groups, they've done surveys among professionals, and there's going to be a professional education symposium at the Child Neurology Society. And that's just starts from something informal, reaching out and saying, hey, we're having a lot of challenges, how about you? And just building that information to know this is a greater systemic problem, and how can we work together to fix it?
Well, I would say, sort of to reiterate something I said earlier, that we're really looking for, when we look to partner with communities, we look for things that we believe we could provide, where we could provide value in helping to replicate and scale an idea, or a piece of technology, or an approach to doing something like the collaborative, patient-led collaborative research networks. Because we recognize that the community that developed that, they should keep working on their disease, and those are their interests, and they need to keep marching in that direction. And even though many times they want to figure out how to help other groups do that, they may not have the capacity to spend and they shouldn't spend all their time mentoring others on how to do it and telling them all the steps and training them on how. They should keep working on their thing. And we think, like, can we help you to figure out how to scale this idea? So that's sort of one thing that we do, or one way that we think about it. I think what's key to partnership is there has to be some overlap and some shared goal. And I think partnerships can be very informal. And even for us, we are constantly, we spent a full year before we launched Rare as One, just talking to people in the community. And all of those were partnerships in some ways, like where we were just reaching out and trying to get people's ideas and what do you think we could do? How could CZI add value to this space? And one of the things that's so important about collaboration is that it helps to avoid duplication, right? Because in the rare disease space in particular, like, we can't afford duplication. We have to figure out ways to create more efficiency in all the things that we do that. And the best way to do that is to recognize where you have shared goals and where you have different organizations that have different capacities, that have different strengths, and that you can figure out ways where the whole becomes more than the sum of the parts by working together. And so we're constantly looking across the community, looking for ways that we can either help encourage those collaborations to happen by providing, say, funding, or by just introducing people to one another, and where we can play a role that maybe another organization can't. And then staying out of the way where we think that we actually don't, where those things actually don't align.
So for us, we really look at whether or not the opportunity is going to meet one of our core goals. And so, as a public policy organization, if someone wanted us to do like a major awareness campaign, if that campaign was going to help us pass public policy, we're in. If that campaign is just awareness for awareness sake, probably wouldn't really, we might do a social media post or something like that. So really trying to find out whether or not this will help our foundation's core goals, because there's a lot of work to be done. And you really have to be kind of very particular of whether or not this is really going to advance your personal organization's mission. Or the other thing is, which has gotten us into a lot of space, the newborn screening space, for example. The diagnostic part of our mission was actually added later on. We are wholly focused on treatments. And the reason why we got in the newborn screening space is the board sat down and basically said, if not us, then who? And there was no one else. We were the public policy organization. We worked across the disease area space, and we knew that if we didn't get into the space, there was no one else to do it. And so that is one of the reasons why we partner in the space too, is because we were so new into it. But that felt as a foundation, it was our responsibility to get into the space.
So, again, you've all touched on so many different aspects of collaborations and partnerships, and there's so many different ways to do them. There's different models, membership models, and more laid out and contractual models and things like that. So again, thinking about things that you've learned that are sort of shared with all these collaboration and partnerships, I would ask, what's the most important thing that you feel like you've learned or you've gained through your work from developing partnerships or developing collaborations? Who wants to go first?
Okay, I'll go. I think that Tania said it. It's what are the shared goals that you have, and making that the priority for where you're heading in your partnerships. And then, Julia, you showed this slide about it doesn't matter who gets credit. You leave your egos at the door. That you really buy into your shared goals and make everything that you do work towards that.
I think the critical thing is to think about, collaborations are really relationships, and relationships are ultimately about people. And I think that is the most important thing that I've learned, is about how, by acknowledging people's stories and finding out about their interests and what they want to do, and bringing them in and saying, great, let's do that. And then for them to acknowledge my story, for us to be able to basically have a relationship in the rare disease space and say, we're both brought here. There's a club. I always say it's a club you never wanted to belong to. So it's a club we're in, nonetheless. And so what are we going to do sort of to make our space better right here today? And so it's about people. And so Julia and I think, want to share a story about how this happens, because we have relationships with people. This is how Julia and I ended up doing immigration policy over the last 2 weeks. You're like, don't you do rare disease? Yes, except that there was a new rule that had the administration sent letters to folks that had been here. You heard earlier as well about clinical trials, because of the small populations, needing people from all over the world to participate. And somebody in California, Isabel Bueso, got a letter essentially denying her medical deferred action, that she gets weekly treatment at UCSF, and was here originally from Guatemala on a clinical trial, and now gets weekly treatment, and she had 33 days to leave the country. Obviously, Isabel calls us, she calls EveryLife, she was calling everybody she'd met, and we quickly were able to form a group to try to figure out how we were going to not just save Isabel, but save other folks. We needed to make sure clinical trials were still able to happen to solve disease, and we needed to make sure that people who were getting treatment here could continue to do so. And I'll let you take over the story from there.
Yeah, so what the issue was is that we needed to bring in everyone together. So industry is trying to organize something over here. Isabel's working with media over here. Patient organizer, everyone was all over the place. And so the foundation saw our role as we can bring everyone together. And everyone was trying to work in silos, because it was such a very delicate issue, right? We're rare disease advocates, we're advocating for treatments, why are we dipping our toes into immigration? And so people were really afraid for their jobs. Not me, my board chair was like, save Isabel. No problems there, do what it takes. But it was a really tough issue, but our ability to basically force everyone to work together. So I got, an invitation for a call with a company. Well, I just forwarded to everyone who was working on the issue and invited everyone to join and to stop the telephone. Well, I heard this from so-and-so. I heard this from so-and-so. And so, we each divided up the workload. Angela was going to work through her state legislature, Senator Feinstein, because she's Cal Rare, she's got the relationship. Industry was going to work with their stakeholders. we were going to work with getting patient organizations signed onto a letter because we have that ability. So we're really dividing up the work based on our skill set. We have not won. This issue is not over. We do have 105 organizations signed on to the letter. We have industry got, I think, around 60, 65 industry CEOs signed on to their letter. But while it is a humanitarian issue, it is a clinical trial issue. If we cannot bring people in from other countries to participate in clinical trials in the US, those clinical trials will start somewhere else, and our US patients will not have access to those trials. And so that was, one of those, we don't care who gets credit, right? We just need this issue to be fixed. Basically.
In fact, nobody knew we were working on it.
Yes.
Isabel knew, but the New York Times, who did the story, they had no idea that we had this working group. We were trying to just have these calls and have everybody doing something and know what everybody else was doing. And we wanted to tell that story because it was about the relationships that we had already built of just like talking with people, but then also saying, wait a minute, let's get all around the same table on this issue. And it was because of those relationships that we had already built and had worked together that we were able to quickly bring together a group of people to work on this important issue that isn't going to just affect this one person, but it's going to affect future for all rare disease patients in the United States. And it's those people connections that I feel are the most important part that I've learned and have been most important to me. And people are like, oh, you did this? No, I didn't really do it. We did it. There were a lot of people. It wasn't just me. And I think that's the piece. It's about relationships. And so being here today is great. And so at lunch, I specifically pick a table where I didn't know anybody. And we just started chatting, and I met some great people. Lucky for me, 4 of them were from California. Yes. Must have been that whole radar thing. So it's just about relationship building. So take a chance. Sit down with someone you don't know. Talk with someone that you've never met. That's why you're here. It's like the ultimate swapping cards thing. Just go up and say, hi, I'm Angela from California. Where are you from? And that's how you start to build the relationships that lead to the collaborations that allow you to do really big things.
Tania, did you want to add one more?
I will just quickly, I know we're running out of time, so I will just build on that to say I agree so much of what I've learned in working in, before I was at CZI, I worked a lot in science policy, tackling really complex, policy challenges and bringing together different stakeholders, just like you just described, from different places. And when you build and convene groups from really different places and try to build coalitions and get people to collaborate and work together, it can be enormously challenging, and it takes time. And it feels really inefficient at first a lot of times. And it's because you have to build those relationships. But the thing is, I think if I've learned anything, it's that is time that is so well spent. That is what will bring you much more efficiency as, once you get over, there's almost like this threshold where you get to a certain point where you have those connections that you need to do what you're trying to do. And I guess what I've learned is it's worth putting that energy and time into that, because that's actually how you build much more efficiency and much more of an impact in whatever you're trying to do at whatever scale it's at. And so collaboration is the key.
It's that scaling up. So how do you scale the one-on-one relationship up to a group of people or a coalition of people?
Great thing. I think we have time for a few questions. Anybody has some questions?
Everybody wants a nap.
It's a quick question. I'm Canadian. Is there any? Oh.
See? You've just found your tribe right here.
And I'm so impressed. And I'm wondering, do you stay pretty much in the States, or do you go other places?
Yeah, go ahead.
So the Tuberous Sclerosis Alliance has formal global partnerships and have helped start patient advocacy groups in different countries around the world. So we've extended the model of empowering individuals living with the disorder in the US and helped start groups around the world.
let others ask questions.
We would love to go international, actively fundraising. We'll get there.
Hi, my name is Annalie Navarro, and I'm here from Atlanta. My daughter was born with biliary atresia, which is a disease of the liver. She ended up having to get a liver transplant when she was 7 months old, and I was her living donor. So we are very active when it comes to fundraising, and we're involved with research. So our main goal is to help fund research, but then through social media and some stories that they've done on us, I've had a lot of people reach out to me from other countries. So I guess my question is, what do you suggest is the best way for us to start building relationships with other? There aren't any official biliary atresia foundations anywhere, and I'm planning on starting the first one. So how do we start to become more global, because there's obviously a need, and so I'm pretty good with languages. I speak like another 3 languages, so that's helped out to reach out to other people. But how do I start to build a whole network of people in other countries where we can collaborate together and maybe create another research program somewhere else as well?
Sure.
Hi, I'm passing around a little green book, and I'm asking you to please put your name, the name of the organization, your purpose. I'm Rare Disease Rule, and I'm global. I want this so that people can go to this page, find their rare disease, reach out to you, and carry on from there. So if you'd like to join it, please put it on, and that's where I'm going international with it. So I hope that helps anybody in that field or, advocating.
Yeah. We are also part of an international loose consortium of TSC international groups. We've gotten some support to bring those groups together, usually around a research conference, and have driven forward very specific projects. So improving care resources is one of them. How can we look at the different care that is around the world and together help improve the kind of comprehensive care that people can access? I'm happy after this to have a conversation with you about that.
Any additional questions? Anybody? Oh.
So one question I have, my son has complete DiGeorge anomaly, meaning he's missing his thymus gland, and so he has no immune system. And there is a research study at Duke University to do transplants for them. And one of the problems that our community has had issues with is its international problems there, and then also just so spread out over the country. It's about 10 to 15 are born a year with this condition in North America, so it is pretty rare. And one of the other problems we found is, since it is still a clinical trial, it's in the process of FDA approval right now, but the patients that are post-treatment, post-transplant, being able to share as much information with the pre-transplant people while getting the investors and things involved that are helping fund the research, because they can't be construed as trying to recruit us for their specific treatment where they might make money. And so I think that's been one of, as a pre-transplant family, a problem we've had, because we can't be participants in so many of the discussions of a foundation because of those constraints of the location, and then also the investors in the drug trial. I don't know if you'd have any advice on going down that avenue of there.
Sounds like another one for Kari.
Oh, I don't know.
Maybe.
I wasn't sure of the specific.
So my question is an advice on where it's a small community and spread out nationally,
Yes.
but also where the clinical trial research are involved, and information that's not being able to share with within the community freely, but still trying to support each other in that spread out location.
Do you guys have private social media
We do have a
sites
Facebook
set up?
group, yeah.
Okay. I mean, that obviously, if it's private and closed, it's something that we offer at the TS Alliance, and many of our sister organizations do that as well. There are also other communities, like through Inspire, which we are also part of, where there's sharing of more medical information that can happen on there. They also have the opportunity on Inspire to have private like sessions with a speaker, so that might be something that you might look into, and Inspire is here at this conference. So that's another resource I might suggest.
Thank you.
All right, well, thank you all. I'd like to take this opportunity to thank every one of you for sharing with us. I appreciate it. I think we have just a couple of housekeeping announcements really quickly.
Right. Thank you, Kari, Julia, Angela, Tania, and Maureen for sharing your experiences with us today. If you're interested in learning more about this topic, stop by our Global Genes booth or help desk to learn about our upcoming data DIY in October. At this time, we will have a short 15-minute break before heading into our closing session in the main ballroom. We invite you to connect with our speakers and check out our back table for resources. And don't forget to let us know how we are doing by taking our quick survey on the mobile app. Thank you.